has a personal interest in HIV and co-infections, STIs and TB, and currently researches acute HIV and Thai MSN, HIV cure, HIV and Neisseria gonorrhea vaccines, and is also a visiting lecturer for the Pediatric Infectious Diseases Fellowship Program at the Faculty of Medicine at Chulalongkorn University. Over to you.
Thank you for your kind introduction. During the next 15 minutes, we will cover the update in gonorrhea management based on the current guideline and focus on the gonorrhea prevention, including a novel prevention strategies such as doxypep and gonococcal vaccine. Gonorrhea is the second most common reported STI worldwide. However, the precise of global burden is difficult due to lack of diagnostic test or reporting system in some regions. And in 2020, WHO has estimated the incidence about 82 million cases in 2020 and set the goal to reduce gonorrhea by 90% by 2030. And how about gonorrhea in Thailand? As you see on the slide, the gonorrhea in Thailand is the second most common after syphilis, and when classified by age group, adolescents and young adults aged 15 to 24 years are at highest rate, and especially for the past 5 to 6 years. And this is a study by Dr. Paramet at Buddy CU Clinic, which is an adolescent one-stop service clinic at King Chulalongkorn Memorial Hospital, to assess the prevalence of gonorrhea and chlamydia among adolescent MSM and TG. And the results show that about 1/3 of adolescents had gonorrhea or chlamydia, and the gonorrhea was detected in about 20%. For the risk of getting STI, including the report both insertive and receptive anal sex roles, previously diagnosed with STI in the past year, and living with HIV. So the screening in these high-risk adolescents are important. And also gonorrhea resistance is a growing concern, and this is a systematic review of the antimicrobial susceptibility data, and it shows that they are increasing of the MIC of ceftriaxone and azithromycin from 14% to 35% in the past 5 years. And from the global surveillance also found that they are increasing in the MIC worldwide. So this leads to the importance of the continued gonorrhea prevention and also the update in the gonorrhea management guideline. In 2024, WHO recommends a higher dose of ceftriaxone to be 1 gram intramuscular for uncomplicated gonorrhea due to the concern of the rising MIC over time. And also Thai guideline has updated to use a higher dose 1 gram ceftriaxone for uncomplicated gonorrhea. And if the chlamydia infection cannot be excluded, prescribed, or the oral doxycycline for 7 days should also be provided. And let's move to the gonorrhea prevention. The key of gonorrhea prevention and also other STI remains the consistent condom use, although we know that it might be challenged, particularly in our adolescents. And in the past, the prevention of gonorrhea relied on the screening and early treatment and also the partner therapy. But there are novel prevention strategies such as doxypep and gonococcal vaccine. Given that there are high rate of asymptomatic gonorrhea, so the screening is important for identify individuals who are at risk and screen for early treatment with effective regimen to reduce the community transmission. And individuals who have been diagnosed with gonorrhea should also be linked to other STI screening and treatment, and also HIV prevention and HIV treatment. And for the criteria of screening in each group are shown in the slide. And this slide summarizes the molecular diagnostic test for gonorrhea which are available in Thailand. The recommended testing for gonorrhea screening is the PCR or the NAT testing for the high accuracy, high sensitivity for early detection, especially for asymptomatic individuals. However, the rapid test also play important role, especially for the point of care testing in the context of the one-stop service, because it's very simple to use with the turnaround time only 10 minutes and had high sensitivity about 90 to 94% and high specificity about 96%. And it's very, very less expensive when compared to the conventional PCR or the gene expert. In our clinic at at King Chulalongkorn Memorial Hospital, we have the gonorrhea rapid test called ALL test, which shown on the left-hand side, and the airborne test for gonorrhea. And this test is very simple to use as the COVID ATK test, and we found that the results are comparable to the gene expert in symptomatic clients. And the next is the partner notification and therapy. Individuals who had sexual contact with a partner who have been diagnosed with gonorrhea within the past 2 months should be notified and referred for evaluation and provide presumptive treatment. And in case where the partner are unavailable, the expedite partner therapy may be an alternative strategy by deliver the drugs such as the oral cefixime to the partner by our clients. And in some countries, such as the United States, they have the system like a public partner notification, which include the client referral or the client contact their partner themselves, and the provider referral or the provider contact the partner anonymously. However, due to the limitation of the public partner notification in our country, so it still rely on the client referral and also the expedite partner therapy. And the next is a promising strategy to prevent the bacterial STI, the doxycycline post-exposure prophylaxis or doxypep. And there are about 4 studies on the efficacy of doxypep for reduced bacterial STI. First is Ibergay, and the second is the doxypep from France, and the third is doxypep from the US. These 3 studies conducted in MSM and TG only, and there are only 1 study which conducted in women in Kenya. And this is a systematic review of the doxypep in preventing bacterial STI, and the data show that taking 200 milligrams of doxycycline within 72 hours after unprotected sex can decrease chlamydia about 80%, decrease syphilis about 77%, and decrease gonorrhea about 45%. So doxypep significantly reduced gonorrhea and reduced chlamydia and syphilis among MSM and TG, and its effect on gonorrhea prevention rely on the local tetracycline resistance. So for our country, Thailand, this is the data from National Antimicrobial Resistance Surveillance, which conducted at Bangkok STI Center by Dr. Rosapon, and it showed that in Thailand there are high rate of tetracycline resistance, about 80 to 90%. So gonorrhea prevention might not have doxypep might not have effective for gonorrhea prevention. However, they are still effective against chlamydia and syphilis infection. So, and in 2024, CDC and also Thai DDC have been released the recommendations of doxypep, which recommend that MSM and TG who had at least 1 bacterial STI in the past year should be counseling and offer doxypep through the shared decision-making between provider and clients. And for now, doxypep is still not recommended for cisgender women, cisgender men, and other genders. And at initial visit of doxypep, the screening and treat for STI should also be provided, and counseling on the use of the prevention strategies such as condom use, and link the clients to the HIV prevention or HIV service. And counseling on doxypep should include the discussion of the benefits and also the potential risks, such as the risk of antimicrobial resistance, risk of microbiome changes, and the potential side effects such as GI irritation, sunlight sensitivity, and guidance how to take the doxypep, and also provide enough dose for each client. Doxypep should be taken 2 pills or 200 mg within 72 hours after unprotected sex, and for the best effectiveness, it should be taken within 24 hours after sex, and with the dose not exceed 200 mg per day. And during the follow-up visit, the regular screening of STI, the side effect assessment, and also the client should be provided the risk reduction counseling, and also reassess the continued need for doxypep. And this is an example of the recurrent bacterial STI for our client. 22 years old male MSM, he is PrEP user, he had multiple partners, and in 2022 he had gonorrhea and chlamydia infection, and then followed by Mycoplasma genitalium infection, and then gonorrhea again and again. And at that time, there's no recommendation on gonorrhea prevention by doxypep, so he was referred to the study clinic to screen and enroll to the gonococcal vaccine study. And during the study, we have the PCR testing every 3 months, and we found that he still have infection with gonorrhea and chlamydia off and on. And after complete the study, we also offer the doxypep, and he agreed to start doxypep. And in our study clinic, we start to implement the doxypep in an acute HIV cohort in November, and we now monitoring the rate of infection after the doxypep implementation in the cohort. And the last is the gonococcal vaccine. The development of the gonococcal vaccine is challenged because of the gonorrhea can modify its outer membrane to evade our immune system, and there is no evidence that gonorrhea infection can have protective immunity against recurrent infections. And so far, there are no measurable immune marker to correlate with the vaccine efficacy, so this even make it more difficult. However, there are evidence suggests that existing meningococcal group B vaccine has some gonorrhea prevention. And in the retrospective study and the case control study showed that the vaccine effectiveness against gonorrhea infection ranging between 30 to 40%. And for the RCT trial, the first RCT trial is the doxyvax, and this study randomized participants to receive doxypep or no pep, and with or without vaccine. And the preliminary data show that in vaccine group there are some reduction of gonorrhea in the vaccine group. However, the additional data show that the prelim data are not statistically significant. So currently there are about 5 RCT on the meningococcal vaccine to prevent gonorrhea. And I would like to focus only the second RCT, which is the largest RCT so far. This is a study called a MAGI study, evaluate the meningococcal group B vaccine or the bacterial vaccine to prevent gonorrhea prevention. And this study enrolled participants, about 2,200 participants, and Thailand is contributing this study significantly because we enroll participants in Thailand more than a half of the total participants. And the result of this study on vaccine efficacy is expected in 2026. So in summary, the gonorrhea prevention are screening and early treatment, partner notification and therapy, doxypep, and also gonococcal vaccine. And in some regions that have high rate of tetracycline resistance, the efficacy against gonorrhea prevention might drop. However, it still can useful for syphilis and chlamydia infection. So the prescription of doxypep is based on the shared decision making between the provider and the client. And for gonococcal vaccine, there are no approved vaccine for now, and the vaccine is under development with ongoing studies underway to evaluate the efficacy. And that's all for my presentation.
Thank you. Thank you, Dr. Pathariya, to show us the comprehensive aspects of gonorrhea from the clinical cases that we see from day to day in our clinical practice, and also how to prevent using doxycycline, or in the future, hopefully we have gonococcal vaccines. Any comments or suggestion or sharing from your experience? Yes, please.
Great talk. Thank you very much. I'm Eric Argis from here at APROMS. There's a lot on the development and point of care test scale. There's interest in doing resistance-guided therapy, looking at gyre and Parsi mutations for Cipro. Here, I think the background Cipro resistance is so high that that's probably not likely to be an effective mechanism here. That's not, obviously that's other places it would be functional, and a lot of places they're actually looking to make that transition. Is that something that is anyone here looking at resistance-guided therapy, or is the Cipro resistance just too high, quinoline resistance too high to be looking at that here?
As I know that there are some resistance in Bangkok, which Ajahn Rosapon can provide more information on this.
For ciprofloxacin, we have done whole genome sequencing, and we have seen the Parsi mutation. According to, I think that is occur in many countries, that is Parsi mutation. This is a major mutation for ciprofloxacin. Yeah, but for ceftriaxone, we try to conduct to see the PNA60, yeah, by using the leftover specimen from the PCR and see that how many preference that we have. But right now that we try to run for the sequencing about 150 leftover specimen. We have not seen any PNA60 yet. Yeah, so that is surprising that you may know that this is happened in Cambodia and also in Vietnam, that in different genes. In Vietnam, the resistant strain is not PNA, but in other genes. Yeah, so, but in Cambodia it's PNA60, but here we, surprisingly, that we have not seen ceftriaxone resistant gene for PNA60. We had 2 cases that report for ceftriaxone resistant by using European cut point, not CLSI. So MIC is around 0.25 microgram per ml, but we not found PNA60 also. Thank you.
Hi, my name's Gareth Tudor Williams from Chula and from Imperial College London. Just because of my ignorance, you do your partner testing 60 days before any symptoms appear, but my understanding of gonorrhea, I mean, obviously it may be asymptomatic in women, but mostly you're going to develop symptoms within maximum 30 days, isn't that right? So how do you justify the 60-day partner testing? Because that must be quite difficult to achieve.
So we used 60 days before diagnosis. So if the clients have asymptomatic, so we used 60 days also, and for the symptomatic client, we also use 60 days.
Actually, because of the 60 days, we use not only for gonorrhea, but also in other disease. So make it easier, so that's why we use in generally 60 days. I understand your point, but for the patient that have extragenital infection, So if it's possible to call back the partners in the last 60 days, it would be good because they will not have any symptoms. But if not, yeah, the recent partner will be great. Thank you.
And I think I would like to point out that in Thailand, we don't have a public health system to ask partner or notify partner that they are in contact with people who have STD like you have in maybe in UK or in US. So mostly we would ask that person to recall and invite their partner to come in, and that one, I think it's also another layer of sometimes it's uncomfortable to call your boyfriends or girlfriends that I have some STD, you should come and get tested. So I think that's still like the system that is not implemented in Thailand, right? In UK you will have a system of public health notification. In US you have. I'm not sure about how about in Cambodia, Vietnam, or some countries. Do you have any public health notification that you might be in contact with someone without saying the name of the person of the index case? Yeah, please. Please come to microphone.
Hello, my name is Sina. I'm from Cambodia. I work for, actually I'm not a physician or the doctor. I am just a data collector with a syphilis case or HIV. Actually in Cambodian, when we have, it's in my province, it's first time for me to come here. When we did detect the syphilis case, we have the referral system that we notify to partner, but however, you know, the number of partners comes to is very low, and so it's very hard. Actually, in Cambodian, for when we actually for HIV, we, you know, when we reactive, the number of patients come to confirm is high, more than, I can say, near 100%. But for syphilis is very low, you know, about 50% that's come to confirm, especially for the pregnant women. It's very hard, yeah. So it's still challenges for us. Yes, thank you.
Thank you. And maybe another option is expedited partner therapy, that you give medicine and then they give to their partner rather than wait for them to come to clinic, because sometimes it's difficult. Thank you so much. So thank you so much, Dr. Pathariya. So in the last talk for the first half, we would like to shift towards the, sorry, you have some comments, Dr. Pathariya, one comment please.
Hello everyone, I'm Hiệp Nguyễn from Vietnam. Thank you very much for the very informative presentation, and I'm very interested in the project when you also mentioned about partner notification. Actually, for Vietnam, we don't have the public health system to notify the partner. However, in our program like PEPFAR supported program in Vietnam for HIV/AIDS prevention and treatment, we apply partner notification services in providing the service in terms of case finding or something, including STI like syphilis, for example, or gonorrhea. I'm really interested in any kind of sharing of experience how to reach their partner for those who have a positive gonorrhea and other STI, something like that. So as you mentioned, like it's quite difficult to check or to also reach the partner, like HIV, people living with it, IV partner of people living with HIV, or partner of who have a STI, like this. So do you have any experience in terms of doing effective intervention for doing partner notification? Thank you.
Sorry to say that we don't have a good answer, but Dr. Pathariya, you want to address?
I think the problem is that most of the partners are one-night stand partner. So when we ask about how about your partner, could you bring him to the clinic? And so he said, oh, he cannot remember, it's one night stand. So that's the problem, especially for adolescent and young adults.